Hello, I'm Alina Moran, and I'm the president and CEO here at California Hospital Medical Center. And I'm excited to share with you some of the wonderful highlights of what happened this past year, as well as where we're going in terms of our future state. I'm also excited because it is my 4th year anniversary here at the hospital, and to really see the impact that has happened in the last few years has been amazing. As you know, we are deeply committed to health equity, and that comes from the understanding that people's health shouldn't be determined by their zip code, their immigration status, where they come from, or their color of their skin. And so what we do here is really focus on ways that we can try to provide that equitable healthcare environment. And a few programs that we've been able to continue to amplify has been our work at Hope Street Margolis Family Center. This work is something that, while it's been going on for 30 years, we just continue to see the impact that it continues to have in our community. And so Hope Street Margolis Family Center is a way in which we're really providing early education, early intervention, and have the opportunity to impact over 5,000 children and families per year. And this work is really an innovative model that really looks at creating partnerships, not only with our parents and with our children, but also with other community-based organizations. We are focusing really on what are the things that we can do to ensure that we're transforming communities and focusing these efforts to impact the world and also impact the lives of our children. And as we continue to honor and the work that we do at Hope Street, we continue to see the impact that it's had on multi-generations because of the work that they've been able to accomplish. The second program that I wanted to highlight is really our work with Samaritan. So Samaritan is a technology platform that really provides financial resources and support to unhoused patients. And through our work with Samaritan, we've been collaborating with community clinics and providers to provide Samaritan beacons to our patients. And we've been able to provide this to over 200 patients to date. And we're so excited about these efforts that we actually want to expand these efforts and do a phase 2 in which we'll be able to reach out to another 500 patients with this app, with this particular app. But one of the things that really helps to drive this work is really our Health Equity Fund. This is a fund that really helps us to be very creative and innovative in the partnerships and in the services that we're able to provide. And this continues really our mission to be a hospital without walls, to really think about holistically what are the things that we need to provide to our patients, to our communities, to keep them healthy and to keep them engaged in their care. And Samaritan and Hope Street are just 2 examples of the work that's happening here at California Hospital Medical Center. So in addition to the work that we've done around health equity, we've also, as a hospital, have had a few recognitions this year. So we've been recognized by U.S. News and World Report for the work that we've done related to stroke, related to our COPD efforts, related to pneumonia and heart failure. And this has been, just a credit to the wonderful caregivers that we have here at the hospital. In addition to that, we were also recognized by the LA Downtown News for being the best hospital in downtown Los Angeles. So we're very excited about that recognition. And we'll continue to strive to make sure that we continue to be the best hospital, not only for downtown, but for all of LA County. So we're very excited about our new tower. It's really an investment in our community, and we're excited that it will be opening up later this summer and fall. It is a $215 million expansion to really provide additional services to our vulnerable communities. We're focusing on 3 major service lines within our new tower. First is going to be our emergency department and trauma center, and that's going to give us the ability to expand services, not only within kind of the walls of the emergency department and trauma center, but also in terms of leveraging technology, leveraging opportunities around providing private spaces for our patients in our communities, and also thinking about how do we continue to promote these services in the community. We are also expanding our maternal and child health services through our new tower. And this is really leaning into the work that we think is valuable. There's a lot of hospitals and health systems that have made decisions to actually reduce or close their maternity services. And we actually know the importance that this has in our community. and the important role that we play as an organization, especially within the downtown community. And so this is going to allow us the opportunity to expand those services. We're also going to be able to expand our NICU services, which is our Neonatal Intensive Care Services here at the hospital. Once again, really understanding the commitment that we have to providing equitable care, but also the importance that it is to make sure that children and families have access to great care in the beginning of life. In addition to our work in the new tower, the opportunity about moving those services there is that we are going to have space, which is something that you can rarely say within a healthcare environment. So with that space, we want to make sure that we're really meeting the needs of our community. We want to make sure that we understand what are the services that we would like to expand, what are the things that we would like to invest in. And through these efforts, we're going to be going through a master planning effort with our organization to really understand the impact that we'll have by expanding these services in the community. So we're extremely excited about that effort as well. We are also excited about something that happened this year, which is our collaboration with Morehouse School of Medicine. And we call this partnership the More in Common Alliance, which is really a 10-year partnership between Morehouse and Common Spirit Health. And we were actually one of the inaugural sites. So our family medicine residency program here was a hospital-sponsored program. It is now sponsored by Morehouse School of Medicine. They have become our academic partner. And we definitely have seen the impact of this partnership, not only in thinking about our current residents, but also thinking about the impact to our future residents and to future medical students. It's going to create a pipeline to be able to really diversify our medical staff here at the hospital. It's also going to help us to really think about how do people engage in care. We know through numerous studies that if you have a provider that looks like you, that's going to impact the ability to really understand the care that's being provided and also how you accept that care. And so this is just one way in which we're continuing to lean into our health equity efforts. And the partnership with Morehouse School of Medicine will continue to help drive that work, not only here at the hospital, but across our health system. It's a very unique opportunity and partnership that we're very excited about. And we know definitely that it's going to help us to drive health equity within our organization. In closing, California Hospital continues to be a trusted beacon of hope, continuing to provide opportunities around transforming communities, addressing social determinants of health. And I want to thank all of our donors and supporters and our caregivers that have helped us to continue to really reach out and confirm our efforts and our mission. But I do want to encourage you to continue to support us. And one of those ways to support us is to go to supportcaliforniahospital.org and really donate to continue to impact health equity in our community, to continue to support the wonderful programs that we have here in the hospital, and to continue to help align us to continue to be the best hospital in downtown Los Angeles. Thank you.